Kids, we are from Can Kids, so we would just like to briefly go about explaining what is our role as Can Kids employees and healthcare providers. What is our role in helping children with cancer and their families? We have a lot of roles that we play. The first one is that we strive to provide the best pain and symptom management as possible to every patient that comes to us. The second is we try to help be a bridge between the treating professionals as well as between the patients and the treating doctors. And the third being that we provide emotional and psychological support throughout the patient's journey from diagnosis and beyond. And even when the child relapses, we are there for them through bereavement and through loss. We are also there for our patients. Other than that, we provide economic support in terms of facilitating the government funds that are there for cancer patients. And we also provide informal education for our children so that they do not fall so far back behind in education when once the treatment is over and they go back to school. So we ensure that this education is continued throughout their treatment here at the hospitals.
Now we are going to describe you about the impact of childhood cancer over the treatment phases. We can describe it in 4 phases. The first is diagnosis, second is treatment initiation, third is illness stabilization, and the last one is end of treatment or end of life care. But today we are not going to talk about end of treatment. We can only talk about end of life care. And I'm sure probably you all remember yesterday our chairman Ms. Poonam Bagai, she was explaining that though our center is Pediatric Palliative Care Center, but we get many OPD patients and in fact inpatient also. Many of them, we treat them, we heal them in all these 4 phases. So quickly we will talk about all these 4 phases.
So the first phase is when the family is told that the child has cancer. So that's the time when they are thrown into a totally new reality, a reality that is confusing as well as scary, because they have no idea what this disease is, what treatment is going to be done, and what is the duration, and will the child ever be cured of this disease or not. So this is what plagues the minds of the parents and the families of children with cancer. And they go through various responses, as we all know, of guilt, fear, disbelief, and the various other emotional reactions that they have.
Why unrealistic? At times they come to us, and when I ask them, this is just the diagnosis phase, and after 1 or 2 chemos, the parents come and tell us that, my child is now doing better. Maybe after 1 or 2 chemos, the size of their tumor has decreased, or the child, they have started having food regularly, and suddenly the parents, they feel that the child has become okay. And they come to me while doing counseling, they say, ma'am, can we go back home and start sending our children to school? Yeah, we can come for the chemo. Whenever the dates will be there, we can come for the chemo, but can we go back home? Then at that point, we have to explain them, no, you have to follow your treating doctor's advice, and whatever the doctors are saying, they say, the doctor said we have to stay back for 6 months or 2 years or so. I said that you have to follow, because these are the unexpected, unrealistic expectation which we find in parents. And we have also found that just after the diagnosis, when they come, the parents, because of lack of knowledge and because of lack of information, many of them, when I ask them that, do you know the disease of your child? They say, yes ma'am, this is tumor. And when we explain that, yeah, it is tumor, but the tumor is cancerous, they don't want to believe that it is cancer. Either they are in denial or they have less knowledge and information. We have found that the parents are having lot of emotional reactions. The first emotional reaction which we find when after the diagnosis they come to us, they say that, the guilt is the first emotional reaction which we find. Because they say when the first time, the first symptom the child started with, maybe fever, maybe pain, maybe some tumor or nausea, so they go to the local doctors, and after that they go to the local hospitals, and after spending 5-6 months over there with no result, they either they have been referred to AIMS or any other hospitals in Delhi, or when they come here, by the time it is lot of time spent, and maybe after diagnosis, many times the doctors told them that the disease has spread. So then the parents have lot of guilt, lot of fear, and lot of negative emotions like anxiety, anger, and all these things. They feel like that, but not everything negative emotions. They have lot of hope too, because when they say that now we have come to the best institution in India, that is AIMS or any other good hospitals, and now my child is in the hands of best doctors, they have lot of hope that their child will get cured very soon. Now come the second phase, that is the treatment initiation, and in that phase we see that parents' daily life, they revolve around their child, and the parents, they see that the patients are manifesting lot of side effects like nausea, fever, mouth sore, all these things because of chemotherapy and radiation therapy, and at times surgery also. So they go through lot of psychological issues like anxiety, fear, all these things. That is the second phase, and that time providing them with lot of information on the child's status, and if there is any changes in a timely and appropriate manner. And the next point is very important: communication between the doctors and parents. When a parent comes to us and when we ask them about the status of your child health, what is the prognosis, many times the parents say, they show their inability to speak to the doctor, their inability to gather specific information from the doctor. And when I ask them, why didn't you ask about the prognosis of your child, they say, we have lot of fear. If we ask them and the doctor says something negative about our child, we don't know what to do. So that time also we provide them with all the information, and we encourage them to go to the treating doctor and ask them about the child's prognosis. And this is the third phase of a treating phase, that is illness stabilization. In this phase, at times we see that now the parents, they are getting used to their new daily life routine, coming to the hospital for OPD, coming to the hospital for their child's chemo, and going back home, and or hospice or any palliative care center. But suddenly, after some few weeks and a few months, suddenly they come to know that their child's disease has relapsed, or any other severe side effects has occurred. And that is the time again they feel very scared, hopeless. Why this has happened? Again, guilt. Is it us? Because of us the disease has relapsed or so? And that time also we have to provide them with information. And next comes the parental expectations, belief that can change over time. Because when the relapse happens, the parents suddenly feel very negative. The guilt is there. At the same time, they get lot of information from many people, like their relatives, their neighbors, and even from the patients of other parents of other patients also. So these negative information make them more anxious and more fearful. At times we have seen at this phase that parents decline or withdraw their children from treatment, and that is also for various reasons. The main important reason which we came to know, that is the financial constraint. Why? Because when at the beginning, before the diagnosis, when they come here, they at times they sell off their land or anything, and whatever money they have, they take loan from others and they come here for the treatment. And after the many months or so, when they exhaust all the money, then they think that we should go back home because we have lost all the money, we don't have any money. That time also they withdraw their children. And there are other reasons. If the other children whom they have kept in the village with their neighbors or with their relatives, if they come to know that those children, they are not well, they are suffering, then also at times we have found that they withdraw their child, the ailing child from the hospital, and they go back home. Or if any close relative or family member of these parents, they die, that time also they go back home and they take long time to come back. Maybe 3, 4, 5 months, and when they come back for the treatment, at times it is very late and the disease might have spread many parts of the body. And other thing which we have noticed, that the parents are often unwilling to undertake any type of major surgery if there is any girl child. Here I can, in very short, I can tell you a case study of mine. A few months back, from Patna, 2 families came, and one family of a girl child, the other family of a boy child. Both the children were having osteosarcoma, and the Patna treating doctors told them that, you are going for the surgery, and both of your child's leg can be amputated. So when the first time I talked to the boy child's parents, they said, okay ma'am, we don't have any problem. If the leg is amputated and that can save my child's life, we agree to that. But when I talked to the girl child's parents, they said, no way. Because if, the life is saved and if the leg is gone, then how can my daughter, even if she is alive, how can my daughter will get married? So these things we face at this phase of illness and civilization.
So then we come to the last, which is the end of life care, and that phase, and what are the parents' expectations and how we meet them. Is like our goal as healthcare providers is to combine our knowledge and experience with the understanding, values and beliefs of the patient and his family, so that we are able to give the best care, the best suited care for the patient. And in this phase of the disease process, we find that the parents' demands and expectations change over time, and sometimes they swing between 2 extremes. Like for example, we still have a patient with us right now, a 21-year-old boy with metastatic osteosarcoma. Initially, with a huge tumor on his left knee, and with a cellulitis of the same thigh. So initially the parents were like, even though when they knew that it was metastatic, it has spread to the lungs, they said that no, we won't amputate the leg, we just don't want to, because we know the child will die, and we don't want to send him, in bits and pieces to God. When he goes to God, he goes in his full form. He came to us with 4 limbs, he'll go with 4 limbs. So they were very vehement. They said they will not operate, even though the tumor was huge and it was smelly, and it was like it limited all his movements. So that was their initial response to the idea of amputation. Then after a while, then they said, then they wanted to get it amputated. So it was amputated here, and then they were very happy for a period of time. But right now, again, they're questioning us. They're saying, why did we amputate the leg when our child is going to die? Because now most probably he's been diagnosed with brain mets also. So this is this swing that we see in our patients' demands and expectations, which we try to handle it in the best possible way. That's which is still there. Okay,
Here
so
I also want to say that when at the end of life, when we disclose to the parents about the child's prognosis and everything, that time also we have noticed that there is lot of hope, even if the parents, they know that the child is not going to survive. But we have seen that till the last day of the child, they always have lot of hope that some miracle will happen and my child will get better. That which we have noticed in many of our parents who are there with us.
So also in end of life care, we found that once they realized that the disease can't be cured by this chemotherapy. So they seek alternative medicine like Ayurvedic, Tibetan medicine, homeopathic, and all traditional forms of medicine. This is what the parents want. And because although this is unrealistic, like all parents, they want to save their child, so they want to try all possible therapies. So at the end of life, the parents often face a difficult decision and struggle with what to do, what is best for their child. And also we've seen that sometimes the demands of the parents and the child are totally different from each other. Like we just had a patient a couple of weeks back who was from Manipur, a little boy with AML with orbital sarcoma. So he was at his end of life. He was in the terminal stages of his life. And his demand was that he go back home. He really wanted to go back to his home state in Manipur. But his parents were very worried that they won't be able to manage his symptoms once they go back home. So there was a lot of issues that we had to clarify with the parents and also explain. This is our role as palliative care providers, that we try to come to some consensus between the patient and the family. So we spoke to them and we showed that we told them that the child really wanted to go back home and this was the best that could be done for the child, and we would provide them with all the medications required to control any of the symptoms that the child would have. So they were very happy when they went back home. We gave them all the medications, we gave them instructions. We were even available on WhatsApp for them when they went back home. And a few days later he died. Very happy at home.
Yeah, we have discussed about all 4 treatment phases. Now, we just want to say when we involve parents in decision making at the end of life care. From the very beginning, when the child with the family, they come to us, we always maintain a very good rapport and relationship with the parents. So at the time of end of life, we discuss with the parents to help them to take decision at the end. But we have seen that parents feel overwhelmed, though they know that it is going to happen, but when we discuss openly with them, they feel overwhelmed and they are inexperienced to take such decision. That time we have seen most of the time they tell us that with your help, with your collaboration, we want to take the final decision, and we are always there to help them to take the decision. And as Dr. Tenzing was saying, that at times they are confused. We have seen that even if the parents are ready to take the child back home, they are not ready. And when the child is ready to go back home, the parents say that even if you take the child back home, there is no treatment available in the village. So better he should stay here till his last day.
So we also believe that the patients, especially older children and adolescents, should be involved in especially end-of-life decision makings. And we try and ensure that, however, we have to keep in mind the Indian context of family first, individuals later. So how we go about this is, like I narrated in the previous example, we sit down with the parents and we explain the views and the opinions of the patient, and we make sure that at least partially they are followed, and so we stress to them the importance of children in this last stage of giving them the authority, the responsibility of making their own decisions, so that the patients feel empowered to do this even at the end of life. So this is just
few photographs of our children at Camp Kids.
So the first was a boy from Manipur that we spoke about, and the second is the boy who's still with us. He's in his last few hours with us, and there are a few who have died, and there are a few who are still with us, and they are our children of hope.
Thank you.